Do you want us to do this also? Just basically talk about the project?
Yep, just
All right.
3 to 4.
My name's Steve Westereng. I'm the chair of sports medicine at the University of North Dakota, and I oversee 300 athletes we have there. Um, Study we're going to do is a brief sleep optimization program to promote flourishing in college student athletes. The brains behind this is our sports psychologist, Dr. Aaron Haugen, who works with us in Grand Forks, and our colleagues, Catherine Lang and Kristen Hoff, and also Wilford Pigeon, who helped develop the programming that we want to kind of modify to use. Just some data in college students, they basically have been diagnosed with about 28% of them have that depression, and 36% has been anxiety diagnosis. That's just your general college students. Not surprising when you move away from college and take your first exam and all of a sudden have all that stuff going on. You drill down a little bit, our college athletes, depending on their mental health diagnosis, have a range of 19 to 20 to 34%. Basically, it could be anxiety, it could be addiction, whatever it is. Sleep studies have shown that 50% to 78% of the elite athletes experience sleep disturbance. And poor sleep negatively impacts your performance, academics, injury, mental health, and well-being in the athletes. But most report getting less than 7 hours, which if you're taxing your brain and your body, that's probably not enough. So addressing sleep might be an intervention target that we're looking at and addressing other issues. Athlete mental health has been focused on conditions of mental health and not flourishing. So basically they work with after a diagnosis and not kind of overall. And flourishing is defined as positive emotional and functioning well, psychologically and socially. And how this relates to North Dakota, we have the highest rate of students in high school that actually participate in athletics at 67%. So it may very well pertain to them or somebody else. So we aim to assess sleep, behaviors and beliefs, insomnia, mental health symptoms, and flourishing in college athletics. Evaluate the relationship between flourishing and insomnia for a pre-screen and a post-screen with an intervention obviously in the middle, and then evaluate the effectiveness of the CBT insomnia on improving sleep quality, sleep duration, and flourishing in the student athletes.
Hello, everyone. My name is Nicole Derrne. I am not Gunjan Manocha. Gunjan is the PI on our project. I'm the co-PI, and she's on vacation. So she asked me to come and share a little bit about our project. So I am a teaching associate professor in the Department of Art and Design at the University of North Dakota. And you might be wondering, what is someone in art and design doing here at the TRANSCEND meeting? So I work with the geriatrics team through the Geriatric Workforce Enhancement Program to work with the elders at the Spirit Lake Nation on really advancing concepts related to healthy aging using the 4M's healthy aging framework. Anyone here familiar with that? Of course you are, right? Yeah. That framework is focused on what matters most, and mobility, mentation, and medication. And the basis of this framework is what matters most. And so our project is designed to help elders within the Spirit Lake Nation more clearly articulate what matters most to them. And the goal of our project is to increase the elder's self-efficacy in making choices essentially aligned with healthy aging, following again the 4M's framework. And the way we're doing this is to use a qualitative research approach, the photovoice methodology. I'm a qualitative researcher, which is why I'm involved in this project. And we're using an adaptation of the photovoice methodology specifically to focus on art making. And so I'll be leading art making activities with our elders and interspersed with conversations and focus group meetings and culminating in an exhibition. Again, with the goal of really encouraging the elders to more completely or fully articulate what matters most to them. So this project stems also from about an ongoing relationship with the Spirit Lake elders. We've been visiting with the Spirit Lake elders at the monthly Elders Day Out program, which is organized by the Tribal Council, for about 2.5 years now. And this project would not be possible without that relationship. And it's been very receptive and open and has really increased the participation at the Elders Day Out program. So we're very pleased to be part of Transcend and grateful for this participation.
All right. Thank you, Nicole. Appreciate that. And we're on the same grant, so I do know about the 4Ms. And talking about what matters, my project is really well aligned with that statement and talking about what matters for the people of the Mandan Hidatsa Arikara Nation. And so some of my work is in my co-PI there is Dr. De La Cruz, who is the Director of Food Sovereignty for Noita Hidatsa Sanish College in Newtown. And well, I mean, to sum it up, food is more than the parts that make it up, right? So, although I'm a nutritionist and I study nutrients, food is more than that. There's cultural, emotional, relational, spiritual reasons for eating food. So, like if I grew up playing baseball. If you got the little blizzard, or if you're, a Sunday after baseball, it's a ceremonial reason to actually be eating a blizzard, right? You completed the baseball game, you're happy about it, you participated in that. If you had a family member show up, for Thanksgiving and, they brought whatever it is that you don't particularly like, maybe it's like a green bean hot dish or something like that, you might eat it anyway because there's a emotional and a relational reason for you to eat that food. You don't want to get auntie mad at you, so you're going to eat the casserole. You ain't going to say nothing about it being bad, right? So the point is, food is more than just the nutrients that make it up. And the goal of this project is actually 3 phases. First of all, when we first started meeting, we thought, hey, it would be, relatively easy to come up with a traditional menu. Well, that was not easy because we did not have agreement between folks of what traditional foods are amongst the 3 different tribes. So the first part of the project is we're going to be doing a series of qualitative interviews with a variety of different food influencers, if you will, across MHA Nation. So this could be chefs, it could be people who prepare food at institutions like elder program or schools. It could be dietitians and other clinicians. It could even be food producers, so people who are raising certain crops or animals, right? So once we define the principles of our diet and we have some, aspects where we can work on, then we actually have to create a menu. So this is phase 2, menu creation. And boy, creating a menu is also more challenging than you might think. You got to have enough of the food to actually be able to provide it for people. You need to have food that actually is going to taste good, or people aren't going to eat it, right? Of course. And number 3, it has to be nutritious. And all those things are harder to do than you might think. There's a lot of moving parts to feeding people. And then in step number 3, we're going to implement this menu for a 2-week period at the Good Road Recovery Center in Bismarck, which is a treatment center for substance use disorder for members of MHA Nation. And in that process, we're going to do a relatively simple pre-post design. We can't do a full clinical trial because running 2 different menus out of one kitchen, for 125, I mean, it's a lot more. It's like, basically we're doing 3 meals a day for 125 people. That's like putting on a wedding every day for 2 weeks. Okay. It's not as, maybe it sounds easier said than done. Okay. So once we implement it, we're going to take some pre and post data, looking at number 1, clinical effectiveness, which we're going to measure through this cultural connectedness scale. This is a validated scale for American Indians. It's related to both physical, mental health, and the important one for our work, which would be substance use. We're also going to look at the feasibility of doing the intervention. Well, one way to easily do that is how many meals did we actually serve that were traditional meals as opposed to standard, if you will, Cisco or US Foods or whatever the food provider is that's providing that food. And then we're also, of course, going to interview clients and, more important, Good Road Recovery staff to see their thoughts on implementing this intervention. And then we're also going to look at acceptability, how much people like the food in simplest terms. And that will be completed by also, patients number 1 or clients, and then Good Road staff. And the plan here is to get preliminary data that shows the impact of these traditional foods beyond just improved nutrient content and density of the diet, things like ceremony, spirituality, relational health, emotional health. And then use that to actually build out the food production systems and menu for a year-long intervention at the recovery center. But right now, doing a whole year, someone else at the Grand Forks Human Nutrition Research Center, Dr. Dale Brummel, he actually developed an entirely indigenous diet for Great Plains American Indians. The kicker, though, is it was $90 a person a day. So we need to work on also getting the cost down, which comes to the food production end. So anyways, the end point would be a full-on traditional menu for the recovery center that could be done for long-term. And then we could look at more long-term variables like relapse or substance use after treatment and see the impact of these types of foods, ingredients, and food preparation ways on, an important clinical marker. And from there, my colleague, Dr. De La Cruz, she'd like to change the food system at the Head Starts, change the food system at the elder care. So it's all indigenously grown food sovereignty, essentially all the food coming from the 3 tribes supporting the tribes themselves. So that's the ultimate end goal. And hopefully we all get there, but I mean, that's a while off, and that's it. Thank you.
All right. In the last couple of minutes here before lunch, if there's any questions we have for our year 2 awardees, we can start with that. Go ahead.
Mental health. So I think Nicole is supposed to support your grant, but fits into all the rest. Are you measuring other aspects of psychological well-being, eating, belonging more broadly?
That's a great question. As I was listening to Nate speak, I was thinking, I forgot to mention that. So yes, the answer is yes. So we'll be using a variety of scales to test for loneliness and mobility and feelings of well-being and social connectedness. Thank you.
Yeah. Same with, eating.
So hey, here you go. Could be confounding or not. On that, but FYI.
That's going to be a great thing to add to one of our questionnaires. It's a project with 5 different organizations, so there's a lot of cats to herd amongst that. And so we're working on our best to just try to get it off the ground. And when we had first start, like we had thought of a more straightforward, and we kind of had to take a step back to go to where we need to go. So I appreciate it. But the answer is no, we've not looked at that yet. And it would be a great element to add to one of our, questionnaires, probably our baseline questionnaire for the interventional part of the study.
Question.
We are not going to compare them athlete versus non-athlete at this point in time, simply because we have a captive audience in a way. And the reason I say that is the carrot there is if you always bring it back to their performance, they're more likely to participate at this point in time. But basically, based on that, we may continue to move that on down the line and see, because the abbreviated, programming may help a lot more than we think it does. But when you're on a bus from exotic places like Tulsa to Grand Forks, on a sleeper bus, you got to get sleep when you can, and it's got to be quality. So, I mean, that's part of what we're looking at.
Well, at this point, we'll close out this roundtable. Thanks everyone for this first half. We will switch over to lunch and then the poster sessions and then have our afternoon session from there.